Hi, welcome to our Q&A session. We have Sean with us today. He's a recent physical therapy graduate who's incorporating inhibitory casting into his practice. Sean has a couple questions for us today.
Thanks for taking the time today to answer a few of my questions. As I get started, one of my first questions was that I've seen that a lot of my patients want to know if the casting is painful, and I was wondering how you guys handle that question or what you see with your patients.
Well, every patient's a little bit different. The most important thing to do is take the time to explain what's going to happen with the patient. A lot of times when they feel a stretch, they sometimes perceive that as pain. So you want to make sure to see if they're actually having pain. You don't want to stretch them to a point where they are in pain, because then they're not going to be able to tolerate that cast. So if you can find that kind of happy medium where you get a stretch that's going to be effective and work, but again, you don't want to go to a maximal range where they're going to have increased pain. So really, really important to explain the whole process to them. Sometimes also they become extra anxious, and that anxiety turns into kind of fear, so then they interpret any kind of stretching sensation as pain. So the more you can calm them, let them know exactly what's going on, the better chance you're going to be to get them to buy in to what's going on and allow you to do the cast and make it successful.
Well, as Stacy mentioned, it's also important to make sure that we prepare the patients prior to casting. That's why we mentioned that we need to stretch and mobilize the extremity that you're trying to cast prior to application of the cast. So in doing so, you're explaining the whole process to the patient. And if there's a previous pain from a different source or from another problem, on our patients, we ask the doctors to give them some pain medication to relax them, or some kind of anti-anxiety medication to relax the patient. But generally, the stress that you feel during stretching with the lower extremities is because you should feel some kind of a stretch pain, but it's natural to have those initial pain. But rather than that, they should have no pain while you're applying the cast.
Okay.